In this video, I want to go through Christina Applegate's health journey and what her experience can teach all of us. At the age of 36, she was diagnosed with breast cancer, and there's likely a genetic component because her mother is also a 2-time breast cancer survivor. Now, after removing breast tissue, her ovaries, her fallopian tubes, she's doing everything possible to make sure that cancer does not come back. She was unfortunately diagnosed with multiple sclerosis, which is an autoimmune condition that is drastically impacting her motor movements and her nerves and the way that she's even able to perform and do the thing that she loves most, acting. And having a previous history of cancer and now an overactive immune system, it's really important that she's looking at how her blood work looks, what she's doing on a regular basis to make sure she's not more prone to infections, but then not overstimulating immune system so then the MS is worsened, and not squashing the immune system altogether so it increases risk for other infections and disease processes like cancer. Hi, my name is Dr. Lori, and in this video, I'd like to go through the top 3 things that are really important when it comes to modulating immune system, lowering cancer risk, and doing everything possible to live the longest and strongest life. If you're looking to take on a metabolic approach and personalizing your chronic health issues, make sure to go to drlori.ca. Now, it's really interesting because most people that I see in my clinic, they have an idea of why the cancer happened in the first. And so when looking at the history and really just trying to dig around the timelines and the history of what they've been exposed to and what's been going on in their life, most people are able to pinpoint what has actually transitioned and what has turned their health history around. Now, with Christina Applegate, she in many interviews had explained that she is a chronic insomniac. So many years where she was under pressure, having to perform without getting quality of sleep. So if you're up all night and you're not producing enough melatonin, you're actually at a 40% increase of an autoimmune condition and a chronic disease like cancer. And the reason why sleep is so important in this context is your body's ability to make melatonin. There are thousands of research articles on this showing how the hormone melatonin has a regulating effect on the body and can actually drive cancer cells into apoptosis. And not just from a cancer perspective, but melatonin is also really important at regulating the immune system and making sure that Th1, Th2 balance is in check. In my personal practice, I make sure to check what your melatonin levels are. And it's something that is very simple to start balancing on your own. So making sure that your room is completely black at night, getting sunlight in the morning, making sure that you get to bed at a proper time, and then even supplementing if you need to. A really important practice that will help with your sleep patterns and regulating circadian rhythm is learning how to meditate. When you have a high-profile position and a very stressful job, it's common where your brain is just constantly going. And so to try to fall asleep at night can be a struggle. Your nervous system is just not used to calming down and it's revved up for multiple hours of the day. So trying to meditate first thing in the morning, midday, is starting to train your system to induce this parasympathetic mode, which you really need to be in when it comes to healing the body. So like I said, I'm huge on testing. You can test to see what your melatonin levels are, but the other component is looking to see what your progesterone levels are. So you always want to have a balance of estrogen and progesterone. When progesterone is low, that's where more anxiety can creep in, where you don't get into a deeper sleep, and it can also affect inflammation in the body. In a recent study, it showed that supplementing with progesterone and having adequate levels of progesterone in the body can reduce the severity of MS. And the way it does this is it protects brain cells and the myelin sheath from excess inflammation. So the progesterone has a direct inhibiting effect on these pro-inflammatory cytokines that are typically very high in any autoimmune condition. Now make sure before you start lathering on progesterone cream or taking oral progesterone capsules that you get your genetics looked at, because some people can actually convert these progesterone molecules into the estrogen pathway, and then that can have a negative effect on cancer care and other growth factors in the body. Now, after doing a deep dive of blood work, hormones, cortisol, checking melatonin, even checking for oxidative stress on a cellular level, all of that can be done through outside testing, which normally your conventional doctor does not look at. Those are really important puzzle pieces when trying to figure out what is the perfect plan for you. And knowing that there's so many immune imbalances, especially in the case of Christina Applegate, we want to focus on what is the gut doing. So understanding what the good bacteria looks like, if there's any abnormal bacteria in the gut that can actually trigger an autoimmune condition, and then even looking at all the cofactors that support our immunity like selenium and zinc. Now, I'm sure that Christina Applegate has the best of the best doctors and she's doing everything possible to manage this disease process, but I really hope that she is taking a metabolic approach and looking at the whole system of why this disease is happening in the first place. And often a really tough lesson to learn is when to slow down and not be putting so much pressure on ourselves. So I know that the things that you love to do the most, it can start to overtake your whole system and compromise other aspects of your life, but having a critical diagnosis or a chronic disease is really an opportunity to look at your life of what needs to change. So just taking medication and not fixing anything else is not fixing the underlying reason why the disease is there in the first place.